So, hi, my name's Greg Fell. I'm Director of Public Health in Sheffield, and a few people have said to me, so what does a typical day look like for a Director of Public Health? No 2 days are the same is the first thing to say. It's worth me saying a few things right at the outset. Public health is more than what the Director of Public Health does, or his or her team. It's the collective efforts of lots and lots of people, and the vast majority of public health is done by people who don't have those two words in their job title. So almost everybody in the council contributes to public health. Almost everybody in the city actually contributes to the health of the public. So we've taken a 5-pronged strategy to minimise the potential health impact, to minimise the impact on the society and the economy, to maintain an effective overview of all of it, and to instill and maintain public trust and confidence, and finally to ensure that the safety of our responders is maintained as far as we can. So and there are lots of work streams to the response to COVID. There's some stuff about analytic, modelling, surveillance, social distancing, testing, millions of general inquiries come in, day out, what we do or don't do about care homes, what we do or don't do about communication, both internal communication and communication to the public, the locality community response and the amazing stuff that we're doing in our neighbourhoods across the city, both us as an organisation but also the voluntary and community sector. And there's a whole range of different work streams. And PPE is one of the things that crops up a lot. So we'll have a role contributing to all of those. So then on to the exam question per se, the day in the life of, I picked a random day last week. A few hundred queries came in of various types and flavours, mostly into my inbox, occasionally and onto my phone, and about 100 answers to those queries went out, and I observed that a few hundred came in and about 100 went out. There's more questions coming in than we have the ability to get out, and that becomes occasionally problematic. So what were we being asked about? Testing, funerals, modelling, surveillance, schools, what we are and aren't doing about schools, businesses that are still open, are they or aren't they implementing social distancing as per the government's recommendations, mortuary capacity, smoking, sexual health, alcohol. The one thing that was through all of them was PPE. It's the common thing through all of them. So in that same day, I think there were about 7 or 8 meetings. There was an early morning meeting about excess deaths and how we manage those that sadly lose their life. A long catch up with the local medical committee, which is a body that looks after the GPs. The local resilience forum had its daily gold call, the strategic coordinating group. A long catch up with my team, who's doing what, how is the public health input to the response hanging together as a whole. There was the Sheffield tactical coordination group, which is the group that looks at the response to coronavirus across the whole of the city. There was a catch up with colleagues about how best to organise various sources of volunteers, and finally there was a directors group. So all of that happened in a day. The one thing I missed, and I was really sad to miss this, was the Chief Medical Officer's weekly call with Directors of Public Health. Normally a highlight of my week because CMO gives a sense of wisdom and calm. Unfortunately, my friend made some notes, so I kind of get to know what happens. And in between all of that, I lost count of the amount of calls that rolled into my phone, and sorry to those of you that I didn't get back to. I'll keep trying. I nearly managed to find time for some non-COVID-19 stuff, but then someone else called about some COVID-19 stuff, so that spoiled that plan. And in between all of that, I managed to have a cup of coffee. So that's an average day for an average DPH in this period, and all of us are in about exactly the same space.